Good evening. Do you know at least one person that has ever been diagnosed with cancer? This could be a family member, a friend, a coworker. This may even be yourself. There are very few cancers that are preventable. What if there was a safe and effective vaccine that could lower a person's chances of getting cancer? Would you get this vaccine for yourself, or for your child, or for someone that you love? Would you at least want to know more so that you had all of the facts about the vaccine so that you can make a decision, an informed decision, whether that be for or against getting the vaccine? This is a picture of the human papilloma virus. I want to share 3 facts with you about HPV. Fact number 1, HPV is a virus that can cause cancer. In fact, almost all cervical and anal cancers are caused by HPV. HPV can also cause genital cancers for women and for men. And it can also cause oral cancers, and those are cancers that are specifically affecting the back of the throat. Fact number 2, HPV is the most common sexually transmitted infection in the whole world. Also, looking at the slide, you see that almost 80 million Americans have been affected by HPV at some point in their lifetimes. What this means for those of us in this room who have ever been sexually active, whether that's one person, one time, or you fill in the blank, whatever applies to you. HPV is a sexually transmitted infection that can cause cancer. Fact number 3, for people with a healthy immune system, an HPV infection will usually go away on its own without treatment. But not everyone will be this lucky. For people with a weak immune system, such as people living with HIV, it is more difficult for these individuals to get rid of the HPV infection, which means they tend to have more health problems caused by HPV. My research is focused on reducing the burden of HPV vaccine-preventable diseases and cancers in general, but especially among people who are living with HIV and men who have sex with men, because these individuals are more affected by diseases and cancers that are caused by HPV. HPV-related cancers are among a very short list of cancers that are preventable. The vaccine is recommended for individuals between the ages of 9 and 26 years old, and ideally given to children between the ages of 11 and 12 years old. Now, some of you may be wondering, why so young? So let me assure you that your child's doctor or nurse is not trying to encourage your child to go out and have sex, but rather their goal is to make sure that they have the maximum protection against this cancer-causing virus for if and when they do decide to have sex. In closing, I want to ask again, what if, or now that you know that there is a safe and effective vaccine that can reduce a person's chances of getting infected with this cancer-causing virus, what will you do? Thank you.